Hey everyone, we're going to go ahead and get started in about 12 minutes. I just wanted to do a quick sound check to make sure that everyone on the line can hear me. If you can hear me, could you please type into the question box on the side that you can hear me? That would be great. Thank you so much. Hey everyone, we're going to go ahead and get started. We're excited to have you all on the webinar today. We're really thrilled to talk to you guys all about Advocacy 101 and specifically today about communicating with candidates and elected officials, some of the best practices for doing so and some of the best messaging. My name is Kyla Franks. I am the field director at the Tennessee Justice Center. The Tennessee Justice Center is a nonpartisan, nonprofit organization working to ensure that every Tennessean has the ability to thrive and has the ability to have the basic necessities of life met so they can thrive. As a field director, I focus on Medicaid expansion and ensuring that all Tennesseans have access to healthcare coverage and ensuring that our state has the healthcare infrastructure that everyone relies on in a way that is sustainable and ensures that everyone has access to the basic health needs. We are so excited to talk to you all today to learn more about how you can make a difference, perhaps specifically in the fight for Medicaid expansion, but we hope that you can use these tools no matter what type of advocacy that you're trying to do. So this webinar, a couple housekeeping items. This webinar is going to be 1 hour long. We will answer questions at the end. If you are on a computer, you'll see at the side there's a question box, and you can type your questions into that question box at any point during the webinar. Just know that we won't be getting to those questions until the end today. And if we run out of time, we'll make sure to send out a FAQ after the webinar to answer any questions that we did not get to. And just so all of you guys know who joined, we are recording this webinar today, so we'll be able to send out the recording after the webinar along with the PowerPoint slide deck, so you can use those and refer to them in case they're helpful. There'll also be a couple links in the webinar slide deck, and we hope that you can click on those and learn more as well. So we are excited to get started today, and we hope that you guys all find this helpful. So, in getting started, what is advocacy about? What are we talking about when we say Advocacy 101? Well, advocacy is all about persuasion. Advocacy should not be a term that you think someone else can do, but you can't do. You're not sure even how to get started, what you're trying to do. Advocacy is a skill that we all learn at age 0. We know how to persuade our parents very effectively from the time that we are born. Through crying and getting our needs met, we know as human beings how to persuade, and we are born with this innate skill. This is something that all of us can do, and is not something that just a couple people who know all of the facts and all of the statistics and have gotten really in the weeds on the issues can do. This is something that everyone is accessible to everyone. And it's important that everyone is able to, feel that they can get involved in influencing policies and influencing change, because really what matters is hearing from local people in local districts, talking to elected officials or candidates to be elected officials. So this is not some niche that you have to come into with a lot of set skills. You have all of the skills that you need to do this. So what's persuasive? When we're contacting elected officials and when we're contacting candidates for public office, what are they listening to? And I think it's important, just to emphasize again what I just mentioned. What is not effective is being a policy wonk with too many statistics. What is effective is storytelling, relationships that are built with the elected official or with the candidate, and concise arguments. So I would say the number one thing that we encounter here at the Tennessee Justice Center is people saying, I don't know enough about this issue. I really just can't get involved because, you know, what about this? And you know, what about the specific number of hospital closings and the rate of the opioid epidemic in this county and, you know, the specific of this, you know, aspect of the policy issue and block grants. All of that is important, and we hope to give you, especially for Medicaid expansion, all the tools that you need to feel empowered. But just know, just because you don't have all of the specific policies down pat does not mean that you can't advocate for your community, for your neighbors, for yourself, and for your local hospital and for the people you know, who surround you, for all Tennesseans as well. You can do this. And what is most powerful is telling your own personal story, why you care about this, why it matters to you. It could be a neighbor who you've met. It could be your husband or wife's healthcare story. It could be your child's healthcare story. It could be someone at your church. It could be whatever is most important to you. That's what really matters. And that is what is going to change hearts and minds and be able to influence policies in a way that almost nothing else can. So we'll all emphasize that again and again through the webinar. But I wanted to include it up here at front because people get intimidated thinking that they need to know too many things. Also, it's all about relationships that are built with people in terms of relationships built that are respectful, that are listening, that are, you know, really understanding where another person is coming from. That's persuasive. So even if that person is a lawmaker who you may personally disagree with, understanding where they're coming from and, you know, explaining your own point of view and building that relationship in a way that is trying to move the agenda forward is very, very powerful. And again, we'll get into that a little bit more. And finally, concise arguments are really powerful. So don't worry about the 10-page reports that you haven't read about whatever issue. Really keeping it simple, keeping it to the point is what is going to be the most effective thing. And there was actually a survey that was done that I was asking about lobbying activities and how influential they were in shaping members of Congress decision-making on legislative issues. So these were federal members of Congress. And they asked, you know, what are the things that really make a difference? Well, 87% of staff members said it was very effective when someone provided consistent, reliable information. So consistently hammering on just a couple points reliably. And 85% said it was very effective when someone presented a concise argument. So 85% of staffers think that if you keep it simple, keep it concise, stick to the main points, stick to reliable information, then that is what is going to make a difference and is going to be effective in persuading an elected official or a candidate about an issue. So wanted to hammer those points because right at the beginning, because that is what we hear most often, is that people think that they need to know more before they can do something. We don't want people to feel like that. There is, you know, one of the main things that prevents so many people from, you know, taking up the power that they leave on the table by not acting is the fact that they think someone else is going to know something more and they'll take care of me. They will do this for me. And really that is, you know, one of the most detrimental things in terms of moving a policy agenda forward, thinking that someone else can do it and someone else will know more and they can just carry it. What really matters is people who, you know just enough to know that how they're affected taking that action. So we want to encourage everyone, even if you don't know everything, to make sure that you're advocating for the things that you're passionate about and that you really, really care about, and to know that you can do it. We also have gotten the feedback a lot. Does communicating with elected officials and candidates even work? Obviously, we think yes. That's why we're doing this webinar today, to tell you about how to make it the most effective. But yes, it does work. And we know, especially those folks who were on this webinar who were working with TJC last year, or just listening to the federal healthcare debates about whether to repeal the Affordable Care Act, repeal the pre-existing conditions protections, gut the Medicaid program and the safety net program, what was the future of our healthcare system, it felt over and over that perhaps our voices weren't working. Over the course of 2017, no matter how many times we called, it seemed that, there was still more threats to people's health care, and that, perhaps people weren't listening. But as we can see how last year ended up, the Affordable Care Act still is the law of the land. There are still protections for people's health care that are in place in federal law, and states still have the opportunity to expand Medicaid because that protection at the federal level has been safeguarded. That was because of a huge outpouring of support from constituents saying that, this was something that mattered to them, and making their voices heard, that their voices mattered. There was an article, it was a great article in the New York Times at the end of last year, saying that several children with serious medical needs who are known as the little lobbyists. There's a photo of this on the slide for those who are interested. These little lobbyists came and met with lawmakers at the federal level. And they were, the parents were explaining how the federal healthcare law, the Affordable Care Act, protected their ability to get health coverage. And lawmakers said that one thing that really sank the legislation to repeal the ACA was the outpouring from the constituents, and few of them were as influential as the little lobbyists. They pleaded for their own lives, and they pleaded for the lives of other children with special health needs. So people's stories and going to see lawmakers and tell their healthcare stories was what changed the tides last year in the federal healthcare debate. And it could change how Tennessee also enacts policies related to our healthcare coverage here in Tennessee. There's also been a survey that I thought was really interesting, which surveyed 260 staffers. This again was at the federal level, and the majority of those staffers were, like 53% of them were in management positions within the congressional office. When they were asked about the various groups and strategies that influence their member of Congress, 46% said that in-person constituent visits would have a lot of influence, and that was compared to only 8% who said the same of a lobbyist visit. Only 8% thought a lobbyist visit was going to have a lot of influence, whereas 46% said an in-person constituent visit would have a lot of influence. So constituents are more powerful than lobbyists. And people worry that, their voices are being overshadowed by lobbyists. I think it's important to realize that constituent voices really do matter. Also, questions at town hall meetings, letters to the editor also have a lot of influence. Postal mail, 90% of these staffers said that individualized postal mail would influence an undecided member of Congress. 90% said that postal mail could influence a member of Congress who's undecided. That's really powerful. And nearly all of the staff, 90%, agreed that responding to constituent communications was a high priority for their office. So in addition to all the policy making and all of the, everything that was going on with trying to decide debates and the committees that they're on, 90% said that responding to constituent concerns is a high priority. So just wanted to, again, throw that out there because we hear all the time, does it even work? And yes, it does. Another thing that I emphasized at the beginning is about building a relationship with the elected official, or since we're in an election season, the candidate. So this is all about, understanding what an elected official cares about, also understanding what committees they serve on and what they said about the issue before. In order to be most effective, it's best to make it easy for the decision makers. You could figure out maybe why they want to support your issue and what's the best means of persuading this person to support your issue. So it's important to think about the most important issue that a decision maker faces in his or her position. Is there something, a concern in the community that's going to override their thoughts and they're always going to be thinking about? You're just going to want to know that, before you would talk to an elected official. What are also the issues that he or she is passionate about? Candidates and elected officials, they're people too. They have things that they really care about and that they're, going to make sure to emphasize. And so, for example, if you're talking about, Medicaid expansion and you realize that one of the candidates in your area or several of the candidates in your area are really passionate about addressing the opioid epidemic in your area, you may want to approach them from that angle and say, hey, well, here's how Medicaid expansion could help in addressing the opioid epidemic by bringing home our federal tax dollars in order to address this issue that you've really identified as a concern. It's also important to know if someone has a personal connection to your issue. There are several instances I can think of in which a lawmaker would have changed their stance because someone may have been affected. The opioid epidemic is definitely one of those examples where someone who would have, someone in their family or a neighbor or someone who goes to their church who overdosed may understand the opioid epidemic in a much more profound way. And so understanding your elected official as a person who has passions, who has concerns, who has things that they're focusing on, and approaching it from that way, it can be helpful, especially if you have the time to look into it a little bit more and understand that. It's also important, as I mentioned a little bit, what committees are they on? What subcommittees are they on? If you're contacting Tennessee lawmakers about Medicaid expansion, it's good to know if they're on the health committees, because it's pretty certain that Medicaid expansion would go through the health committees. So just do a little bit of homework, do a little bit of research. Also, figuring out who influences that decision maker. Is there something that is really, a powerful group in your community, the Rotary or something else that is a powerful group that your lawmaker is always in and out of? That's just important to know in order to be most persuasive and to build your understanding of the candidate in the most effective way. Also, understanding what are others saying to the decision maker about your policy issue. So what are others saying about, for example, Medicaid expansion? Are others worried about the cost to the Tennessee budget? Are others saying don't expand Medicaid because we're going to be in the same situation as 2005? If you knew that, then you could say or get enough information so you would be able to say, hey, it actually wouldn't cost Tennesseans a dime in taxpayer dollars. We would just be accepting money from the federal government that we're already paying into. And then the hospitals would pick up the rest. And if you ever have, especially questions about Medicaid expansion, if you're saying, hey, here's the pushback between my area, what should I say to this? What are others saying about this in my community? And this is, I need help with that. Let me know. Let us know. We're happy to help that with Medicaid expansion. But overall for advocacy, it's important to know sort of what other things that people, the decision maker is hearing. You can pay attention to the news, pay attention to the local media. We just think that that's important. Also understanding, where the lawmaker, elected official candidate, goes to church, what civic organizations are they part of, what community groups, what alumni organizations. All of this is really helpful in becoming the most effective advocate that you can be in understanding, who this person is, because elected officials and candidates are just people who have passions and they care about things. So we hope that, if you have the time to do a little bit of research in order to really genuinely build a relationship with your elected official or candidate, a relationship on which, you're coming from a place that they, what they care about. We know that to be very effective in terms of convincing people of your policy position. But if you don't have time to do that, don't worry. What is most important, absolutely most important, is telling your story and making it personal. You speak with an absolute authority about your own story. No one else can deny your story. No one else can argue with it. And if they do, you guys know how that feels when someone says, well, you actually feel this way. And you're like, no, I don't feel that way. Listen to me tell you how I feel rather than you telling me how I feel. I'm pretty sure we all know how that feels. But definitely you are the absolute authority of your story and what happened in your story. So that's why you don't need to worry about having too much, all of the policy information, and knowing that if you just tell your own story, that's what's really going to make a difference. Because it registers with a politician that you care about it because it's personal. Therefore, you aren't going to be moved. That's one thing, lawmakers are trying to gauge the views of their constituents, but it's not just what their constituents want, but it's how intensely their constituents want it. That's something I think people don't realize. They think if I just, I'm able to say, I think this is a good idea, that's going to make a difference. But what's really going to make a difference is I really want this, and wanting it passionately and intensely because of your personal experience, your personal values, your personal, story means that it's going to register to the lawmaker that you want it very intensely. And that intensity often determines how people vote, and lawmakers know that. Consider, for example, the effectiveness of single issue voting blocks on issues like gun regulation. The majority wants more regulation, but Congress knows that the opponents of those regulations are much more intense. So that's just one example of how the intensity surrounding something can really impact an issue, even if the majority wants something else. It definitely, a set of facts, a canned argument, if that's all you are able to do for an issue, go for it, definitely. But a set of, feelings and personal stories definitely matters much more. In making it personal, don't be afraid to use I and speak from your own experience. You think about what you want to say to a lawmaker and it's all about the facts, think about where you can inject I into it, my experience. Focusing on more than just, even if you're telling your story, more than a list of facts and date. I moved to Nashville on this date. I then did this. I then did this. That's really good. But how you feel about those things that happened in your life helps the listener to connect. So if you're able to say, I moved to Nashville, and then when I got here, I, was taking care of my father who had a serious illness for 6 months. That was really hard. You know what was even harder? The fact that he didn't have any type of health coverage. That is going to draw the listener in if you are able to share about what it means to you. It doesn't have to mean that you know someone who is uninsured if you're advocating for Medicaid expansion. It could be someone who you interact with through your church or through your local or volunteering. It could just be hearing the story of someone in the news. It could be whatever your own personal connection is, whatever is authentically you, that's what you want to share, and that's what you want the listener to be able to connect with. So definitely don't, make it what it's not. You want to share authentically what is your own story. Also, it's important, and I'll talk about this a couple times throughout the presentation, but including a shared moral or value. I can't remember who said this, but there's someone who said Americans, they disagree passionately about very little. Very contentious issues, people care a lot, but about very little. Because when it gets down to it, there's a lot of values that Americans agree on. The golden rule is one, helping a neighbor as you would have them help you. Also just caring for our neighbors, caring for our communities, caring for each other. Liberty and freedom and justice and fairness. These are all things that Americans really value. If you can connect to one of those values, even people who may disagree with you will kind of come at it from the same place. If you can appeal to a sense of fairness, which is a pretty universal value, you can connect it to something, even if that person may disagree, they may be more on board with what you're trying to say. And make sure, as you conclude your story, to transition into your request for support. And I hope you'll support Medicaid expansion to save the rural hospital in my community. You want to make it clear at the end of your story, what is the solution for that? There are, perhaps some of you have had the experience of talking to a lawmaker, telling your whole story, and then they say, and then, we can just do this whole other thing that would be, great for addressing your issue. And then they'll talk about that for 20 minutes. While that may be fine, usually it's distracting from whatever you wanted to direct the conversation to. So make sure to tie it back into what you are supporting or what you are advocating for, and say that that is the policy solution that you want. You don't have to know everything about it, but just knowing that, that's something that is, you're going to advocate for, rather than getting distracted on a different tangent. So one thing that could be helpful is developing an elevator pitch. So knowing that if you only had, 3 sentences to deliver, your story, something that's personal, and trying to say it in no more than 9 seconds, and this is the core. This is what I want to communicate. Keeping it short, keeping it concise and to the point, making it personal is really, really vital. No more than maybe 3 points in your little elevator pitch. And it could be helpful to develop that just 9-second version of what you want to say, because then everything else that you build off of that is just extra and helpful. But hey, this is the core of what I want to communicate. And definitely when telling your story, it can be really helpful to practice with a friend. Just go through it with a friend to make sure they understand the key points that you're trying to communicate. Because that, oftentimes when you say it once, you're not sure if you're communicating it effectively, and definitely bouncing it off of a friend could be really helpful. Especially if you're nervous the first time before, making a call or writing an email or, writing a letter or doing an in-person meeting, whatever it is. So this is just an example of a quick little elevator pitch. 300,000 Tennesseans have no access to health coverage. This included my husband, Robert, who died last year. Medicaid expansion would have provided him life-saving coverage. The lawmaker would then know that you have a personal connection with it, that you're focusing on that main point, that 300,000 Tennesseans have no access to health coverage, and that you're advocating for Medicaid expansion, which would have helped provide Robert and those 300,000 Tennesseans life-saving coverage. That is what they're going to walk away with. All right, so now a little bit, those are some of the general points about what to communicate, but now how? How do we actually make our messages heard by lawmakers? A quick note on what works and what doesn't. What is effective is constituent contact. What is not effective is non-constituent contact. Please remember, you're going to be contacting your lawmakers who are in your district, your representatives. That's what's effective. Generally, it's not effective to hear from someone who does not live in your area. There can be exceptions to that. For example, if the person's in a leadership position, they have higher political ambitions, they're head of a committee, or they just get a huge outpouring of support or opposition for a bill that they're very publicly aligned with, and they care about their public image. So there can be instances where non-constituent contact is important. As a general whole, you really want to stick with your elected officials. Also, what is effective, it seems, pretty obvious, but we just want to put it in there. Contact that requires effort. If you write a letter, not a lot of effort. You don't have to go out of your way and do everything. But if you write a handwritten letter, that's going to matter more than if you just send a quick tweet. Or if you just copy a form email, that's going to matter less than if you put in your personal story into that email. We have seen that handwritten letters, like the ones that tell those personal stories, sometimes lawmakers bring those out and then they reference that story in a speech that they make. You can tell that they've read it and that they're thinking about it. Those have been, it's exciting and powerful when that happens, and it shows that, those times when you take the chance to just tell your story really make a difference. And it doesn't have to be, 10 pages, please, keep it concise, keep it simple. It can be a short little letter. It does not need to be the longest thing in the world. It's really actually most effective when you have a concrete ask and a single ask, support Medicaid expansion. Bam, one thing. It is less effective when you have, in one letter, a laundry list of all of the issues that you care about, or just some general ideas about the world. Having it be much more concrete and much more, focused is much more effective generally. So just some things to keep in mind. We also get asked, what's the best way to contact a candidate or elected official? Generally, but not always, in-person meetings are the most effective, and requesting those in-person meetings with a candidate or elected official are most important. Especially during the legislative session, if you can't get in to meet with an elected official, and you meet with a staff, don't get disappointed. Don't, say, oh no, like, I'm not going to meet the elected official. No one's ever going to listen to me. Don't underestimate the staff's influence over the elected official. Always treat the staff with respect. And, those are going to be the people who are, with the elected official for more than most other people and more time than most other people. So make sure to not underestimate the value of talking with the staff member and getting them, to understand your issue, because they're going to be talking to that elected official. So, and always treating the staff with respect. So in-person meetings, ideally with the elected official, but if not, then the staff member. We've heard that handwritten letters tend to be the next most effective. They take, again, contact that requires effort is more effective. And then calls and then emails. Emails can be pretty easily copied and pasted, but if it's personalized, that is more important. You can also ask how a lawmaker prefers to be contacted. Sometimes certain lawmakers have different preferences. Some lawmakers care a lot more about the emails that they get or the letters they get or whatever it is. They actually have different preferences, and it's okay to say, hey, how do you prefer to be contacted? How do you, where is a type of contact that you're definitely going to see? Maybe it is Facebook. Maybe they have an active Facebook page and the people who comment are the ones, that's what they read. You just want to always, kind of see, hey, what could be the most effective? All right, so getting into those nitty-gritty of calls, emails, and letters. When you're calling an elected official, make sure to be respectful of the staff who answers. Remember their name, explain that you're a constituent, tell your personal story, and keep it simple, one concrete ask. We've gone through a lot of this, so I won't belabor those points, but those calls can be really simple. Usually, they don't take more than like a couple minutes. It's just not a long call at all. And so don't be intimidated by, this long call where you're going to get grilled on about the different various aspects of the policy. It could take 1 minute. We've definitely seen calls that take 1 minute or less. And, it could take longer if you're able to engage with the staff member and tell them more about your story. But don't think that it needs to be this long, 30-minute call. It almost never is. So we'll send out the slide deck afterwards, but in case, you just need a script, you're just don't want to do this call, you think that you should, but you're scared to call your elected official. We just included a script here so you could have it, really simple. Say where you're from so that the person knows that you're a constituent. Say that, you're a concerned resident of their district, and they make it clear at the very beginning what you're talking about. And then explain why you care about it, your personal story. Again, you don't need to go through a laundry list of your whole life, just a couple sentences. And then you want to ask the representative or senator to take whatever your specific action is. And that's it. It doesn't have to be anything more complicated than that. One thing to know, this is for the federal level, when calling senators or calling representatives, only make one ask. Generally, the staff member is marking down a box of what they got a call about. And oftentimes, if they got a call about 2 or 3 issues, they're only going to mark one of those boxes, and they're going to mark whatever one, they or decide they're going to mark. So really, to make it most effective, you just include one ask in your call, because then they're only going to be able to mark that one box that you really care most about. Just keeping it simple. I don't think I can belabor this enough. Do not get bogged down in facts and statistics. You know, I probably should be, you know, talking to the choir here because I do this all the time. I'm pretty sure other TJC staff always say to me, Kyla, like you're throwing too many numbers at me. It's always, you know, I understand the wanting to show that you're really, you know, smart. I know this. I know what I'm doing, but really that's going to hurt your cause more than help. What's going to help is appealing to a shared value. I want to help my neighbor because, you know, in my faith, I believe that the golden rule is really important, and I think we should treat all of our neighbors the same way that we would want to be treated. All right, letters and emails. Again, we kind of included an outline because it doesn't have to be this, you know, long thing. It just has to be something that's clear. Outlining the concern at hand very early on, saying, you know, what you're talking about, why it matters, and the request for action. Same format as a call, just in a letter format, and then signing your name and giving your address. The address is important, and, you know, because then they'll know that you are a constituent. So that's, you know, it's really simple. You can just do it on a piece of blank paper and then, you know, mail it off to your lawmaker. And we'll get in just a little bit about, you know, where to mail it off to. In terms of constituent meetings, those would be, you know, where you're scheduling a meeting with the lawmaker. Or, like I said, with a staff member if you can't meet with a lawmaker. It's helpful to recruit constituents and form a group. I'm sure most of you know this, but the Tennessee legislative session is only the first, you know, four months of the year, and is could be 5, but it's over now. And for the rest of 2018, the legislative session is over. But it's here in Nashville. So, you know, getting together a group of people from your area to come down maybe for a lobby day, or maybe just meet with your elected official, and forming that group to come here to Nashville to meet with them, or meeting with them when they're back in their home districts. So they're going to be back in their home districts for the rest of 2018. And now everyone is a candidate because there is an election this year. So we'll talk a little bit about that in a second. But in scheduling this meeting, it's good to form a group to come with you as well. Tips, keep it to the point, discuss only one issue, organize your thoughts and use notes. Tell personal stories, and something that can be helpful as well is developing a one-page fact sheet concerning your issue to give to the person. So then they can retain, you have a written copy to retain what you told them in the in-person meeting. That can be really helpful. Don't put it as more than one page, just a one-page sheet talking about your issue and what you want the elected official or candidate to do or support. So what happens if you're in this meeting and you're telling an elected official everything about your personal story, why this matters so much to you, everything that, you know, you really just want them to support Medicaid expansion so that, you know, people like your husband can get the health coverage that he needs and he currently doesn't have it. It's really, you know, vital to you. And what about if they just start disagreeing with you, saying, well, you know, we can't do that, you know, we can't pass, you know, more Obamacare here in the state. So what do you do when you're talking to candidates or officials who disagree with you? You just speak really, really loudly, and then when they don't agree, you just say it even louder. Just kidding. Don't do that. Never threaten. Always be respectful. Yelling at someone and, you know, just trying to force your point in is not going to get you where you need to be. Never threaten them. It's not going to work. It's not going to convince them. It's not going to get you any closer to your policy goal. Always be respectful. Something that we talk about a lot is value-based messaging. I've mentioned this a couple times, and I just want to have a whole slide about it. You know, we as Americans have similar values from which we can draw our ideas about what free and fair and just society would look like. Appeal to those common values. Find out, you know, kind of where your elected official stands, and appeal to a value that they may hold. That is where you're going to be able to get the most ground. Other tips for talking to people who disagree with you: listen. There's not a lot of time, you know, I would say when a lot of people who do constituent meetings or calls think about what they're going to say and think about how they're going to present what they're going to say. They don't really think much about listening. It's okay to listen to what your elected official says. I mean, they definitely, you know, there are times when elected officials try to dominate the conversation, so they're speaking the whole time and you're not sharing their story at all. That's not great. But you do want to make sure that you're actually listening to what they say and acknowledging that person's complaint. Yeah, maybe that is something that, you know, is really hard, but then providing that real information, you know, about your life, your circumstance, things that you may know about the issue to address what the other person may be talking about. That, you know, it is really powerful to, you know, when someone is able to listen and is able to acknowledge that another person has a different perspective in a respectful way. You can also find the lowest common denominator to achieve the result. So for example, if, you know, in the scenario just said where you're meeting with a lawmaker, you're trying to talk about Medicaid expansion to help your husband and to help maybe your hospital and your community that's at risk of closing, you know, but your lawmaker says, well, I don't want, you know, Obamacare here and more Obamacare here in Tennessee. And you say, okay, you know, there's a lot of people, you know, reasonable people may disagree about that, but, you know, don't you care about our rural hospital? Don't you care about the hospital in our community? And hey, hospitals are going to be way less likely to close if we have Medicaid expansion here in Tennessee, because it's going to have a way more money. You know, can you, you know, support this just to save our rural hospital and to address that concern? So finding that lowest common denominator is also really important if you know that people disagree with you. And of course, sharing real experiences and sharing stories. No one can negate your personal experience and your personal story. So it's really important to always emphasize that. We also get asked a lot, you know, what if my candidate or elected official, if they already agree with me? As we mentioned, constituent contact is the most important. Don't switch to another candidate or official. You want to make sure that you're contacting your own candidate in your district or your elected official. Ensure that you're continuing to reinforce her position on that. You can be sure that the candidate or the elected official is going to be hearing from the other side. And it's important for them to be reminded that their supporters are with them. So keep that in mind and make sure to, you know, stick with your own district. What about if your candidate or elected official seems hopeless and that they're never going to agree with you? Don't give up. Don't give up. Remember, even if you can't move them to your side, you may reduce the intensity of their opposition and deter them from working hard against you. And that can be crucial. That can be crucial. We saw last year with the federal healthcare debate, Senators Alexander and Corker, you know, through pressure from Tennessee constituents who said to Senators Alexander and Corker, please don't repeal the Affordable Care Act without a replacement. And no repeal without replace then became a mantra that they adopted, that Senators Alexander and Corker adopted, which delayed the efforts to repeal the Affordable Care Act to the point where then more and more opposition started coming out and speaking more strongly, to the point where then, you know, by the end of the summer, they were not able to pass any sort of repeal of the ACA. That, starting with a please don't repeal without replace, got us to the point where that, you know, now the Affordable Care Act is still the law of the land. So it definitely, and we've seen unlikely heroes in many different aspects, people who everyone said that person is hopeless, you're never going to get them to support you. Well, you know, it turns out that when the tides turn and the public is for it and the politics are for it, they do support you. And then getting media coverage and letters to the editor, publicly, you know, saying, hey, this person, I told them my story, my healthcare story, about how I needed health insurance, and they said that they didn't want to do anything to help me. Saying that to the public can be really powerful as well, so that they know that it's real people who they're, you know, impacting when they don't support certain issues like Medicaid expansion. All right, acknowledging the elephant in the room, a lot of this was, you know, about perhaps the legislative session. You know, as I mentioned, the legislative session for 2018 is over, and now we are in full election season. There's a primary in August and an election in November. If you're looking at advocating for Medicaid expansion, all state House seats and half of state Senate seats are up for re-election. So right now, all legislators are in candidate mode. So what does this look like in an election year, aka right now, when the session is over and we're in election time? First, remember that candidates are listening. They're oftentimes, listening more now than any other time because they want to be reelected. They're going to be listening to the concerns of their constituency. In Tennessee, this is also a very volatile election season. There are several seats where, many seats actually, where the incumbent is not running. It's very volatile, and now's the time, when candidates are listening because they know that there's a lot of open seats and change that's happening. So it's important to talk to candidates when they're listening and to talk to all candidates in your race. So make sure to contact not just one or two, but contact all of the different candidates for state house and state senate if you're advocating for Medicaid expansion, but all candidates who are running, that's really important. In terms of time frame, don't forget about the primary, August 2nd, 2018. Making sure to reach out to the candidates before the primary, not just before the election. The primary can often be a very decisive point in an election, and it could be a time when people are listening more. So if you want to educate candidates about, certain issues, contacting them before the primary could be really important. If you're not sure what district you live in and who are the candidates running, well, go to this slide and then click on this link when we send out the slide deck. So to figure out, if you're looking at the Tennessee State House and Tennessee State Senate, which is mostly what we've been talking about today, especially with Medicaid expansion, those are the districts that are going to, matter. To find out what district you live in, go to the side where it says Find My Legislator. Type in your street address. This is the Tennessee Justice Center's address, and Nashville and the city that you live in, and then it'll come up with what district you in, Senate District 19, House District 51. Those are going to be the districts that you live in. In order to find out who's running for State House, who's running for State Senate, go to this page and click on this link. There's a list of all the contact information for the candidates on the Secretary of State's website. It'll give their addresses, so you can write them letters, or you can just find their names and then find their Facebook pages or campaign websites, et cetera, to find their phone numbers. It's really important, now that it's a time when candidates are listening and they want to learn more about the issues, schedule meetings, call them, email them, see if you can meet with them, and meet with all of the candidates in your area to talk about your concerns and your issues. Also, look at all the candidate forums that are going to happen in your area. Go to these candidate forums and ask questions and talk about your issue and talk about why it matters to you. Make sure that if you're at a candidate forum, introduce yourself, that you're a constituent. Thank them for being there. It goes back to being polite, being respectful. Tell a brief story and make it personal to the district, make the issue personal to the district. I care about Medicaid expansion because I care about, the hospital in my county, and if we want to, save our hospital, we have to expand Medicaid. Again, making that clear and direct ask, and, limiting the person, ability to avoid the question. So we want to make sure to focus on that for candidate forums. In terms of why it matters, people speaking out in local districts matter. Candidates are listening before the election, and even just hearing from one person can make a difference. What matters is what happens in local areas for local people speaking out. That is what is vitally important, is going to make a difference. So we have about a little bit more than 10 minutes left. I definitely, if you have any questions, type them into the question box. I'm going to go through a brief 5-minute overview about effective messaging to use in meetings about Medicaid expansion specifically. But I definitely want to address any questions you had about the previous material, about what works, what doesn't, how to contact candidates or elected officials. But in case you're concerned about the healthcare system of our whole state and health issues are an issue that you care about, I want to talk about the Bring It Home campaign. Bring home our dollars, our jobs, and our healthcare to expand Medicaid here in Tennessee. So it's a win-win situation, emphasizing that Medicaid expansion here is it's going to be winning on all sides, in terms of addressing practical problems and, fixing real issues here in Tennessee. So a Vanderbilt poll that was conducted at the end of last year shows that healthcare is among the top voter concerns here in Tennessee, along with the economy. Healthcare ranks as number one alongside the economy. And over 80% of voters are concerned about the vitality of rural hospitals and of hospitals staying afloat. So this is a really important issue to voters here in Tennessee. There was also a poll that was conducted in April of 2018, so just a little over a month ago, which showed that 63% of Tennesseans support Medicaid expansion, and only 21% oppose. This is a photo that was from an article in the Tennessean about this poll. So you can sort of see that in the background. 63% of Tennesseans support it, only 21% oppose. So the tides are turning here in Tennessee. And we can see, overall across the U.S., the tides have been turning as more and more people are supporting bringing home our federal tax dollars to expand Medicaid in our state. So Virginia, for example, just passed Medicaid expansion last week. There really is a lot of momentum going across the U.S. in Virginia, and then in several states like Utah and Idaho, which got enough signatures to put it on the ballot. So it shows that it's really been getting more and more popular there as well. Why? Because it addresses practical problems. It addresses the rural healthcare crisis. It addresses, the safety net for our neighbors. It actually addresses the addiction crisis. We've heard a lot about the opioid epidemic here in Tennessee and the news and other places. And hey, if we actually bring home our federal tax dollars, which are currently going to other states that have expanded Medicaid, we're going to be able to address some of those very real and practical issues. So in terms of what I mean by bringing home our dollars, currently we're giving up $1.4 billion a year. So we're paying the same taxes that another state that did extend Medicaid, like Kentucky, are paying. So we're paying the same federal taxes, and then those federal tax dollars are then going to be going to states that did extend Medicaid, like Kentucky, but not back here to Tennessee. That means that Tennessee is losing out on $1.4 billion every single year in our federal tax money. That does translate also to $3.8 million every single day. 3.8 million every single day. And we just think that it's, really important to bring home these dollars to, address some real issues that are here in our state, for people who are facing, rising premiums, debt and medical bankruptcy. Bringing home these dollars are going to be able to address those issues. So that people can afford the medical care that they need. They don't go into medical bankruptcy, and bankruptcy is, healthcare costs are the leading cause of bankruptcy here, just FYI. And the rising healthcare expenses, premiums are going to rise for everyone if people are uncompensated, if there's more uncompensated care. So bring home our federal dollars is going to address so many of these issues. It's also going to bring back jobs. The University of Tennessee estimated that 15,000 jobs would be created if we brought home our federal health care dollars. And currently, jobs could be lost or are threatened, because of things like, hospital closing. So there's 13,000 hospital jobs that are at risk because the hospital is at risk of closing. So if we don't, bring home our federal, healthcare dollars, we could be losing jobs, not just, foregoing jobs that could be created if we brought home our federal healthcare dollars. And those jobs could be lost because if you see at the bottom of the slide, hospitals are 6 times more likely to survive in expansion states. So by being a non-expansion state, our hospitals are way more likely to close, and then those jobs are going to be lost. Also, what is that going to do to a rural community that relies on its local hospital? It could devastate a rural community. If you lose the hospital, you would lose probably the largest employer, and hospitals are good employers too. Losing the ability to recruit young people to your area, hurting the economic vitality of your area. You can't recruit new industries if you don't have a hospital, and overall hurting the healthcare infrastructure. Tennessee, we have the highest rate of rural hospital closures in the entire U.S. We've lost 8 rural hospitals since 2010, and that's more than any other state except for Texas, which is obviously a lot larger. We have the highest rural hospital closures per capita of any other state. And then finally, for healthcare coverage, there's at least 280,000 Tennesseans with gain coverage who currently have no access to TennCare at all right now. These are working Tennesseans. That includes 24,000 veterans. So these are people who are, currently have no access to any type of affordable healthcare coverage. So they don't qualify for TennCare because they don't fit into one of the categories of TennCare, like parent or pregnant women or children or people with disabilities. Only people who fit into those categories can get TennCare. And since they don't fit into one of those categories, they can't get TennCare or Medicaid. And they don't have access to any other type of affordable health insurance. There's no other option for them right now under the system. So if we extend Medicaid, at least 280,000 of our neighbors would be able to get health coverage, and the vast majority of those people are working. So that's a little bit about Medicaid expansion here in Tennessee, some of those main talking points and the main messaging for that. We would love to stay in touch with you all and have you answer any other questions that you have, give you more information that you need to understand how to best communicate with your lawmaker. If you're not signed up for our email list, or you think you know someone else who may be really interested in what we talked about today, here's a link, and I'll send out this slide deck and the recording of this presentation. But click on the link, sign up for our email list. We would love to stay in touch with you. You can also follow us on Facebook and Twitter. We'll be sending out more information via those social media platforms as well, so you can stay in touch and learn more about what we're focusing on, what we're hearing, what other states is there gaining traction for Medicaid extension, what's the best ways to communicate, and what's the latest. So we hope that you all will get involved and stay involved, and we would love to continue to touch base with you all. So I want to make sure that we have a couple minutes for questions. I haven't seen any typed into the question box, but if you have any questions, I'll give you about 30 seconds to go ahead and type those into the question box now. All right, well, if you think of any other questions after the webinar, we are more than happy to answer them. So we would love to, go and, answer any questions that you have. I got one question from someone who wasn't able to see our PowerPoint slides. Oh, so sorry about that. Wonder what happened. We'll look into that and why that might have happened, but we'll definitely send them in an email after the webinar. So I'm sorry you weren't able to see those slides, but we'll send them to everyone in an email after the webinar so you can look through those and let me know if you have any questions. Sorry about that. Thanks for letting me know. All right, well, we'll end a couple minutes early today. Thank you all so much for joining us. Again, make sure that you follow us and like our Facebook page, and we're excited to stay in touch with you all more. Thank you again, and have a great rest of your Tuesday.